And welcome, you're watching The Agenda, the Saturday edition here on the SABC News channel. I'm Desiree Chalkin. Let's start the show. All right, we want to get to the very latest on the ground in Wuhan. Let's bring in specialist reporter from China Global Television Network, Xin-chen Shoe. Mr. Xin-chen, good afternoon to you, because it's the afternoon where you are. What's the current situation in China in terms of the coronavirus?
That's correct. And I am at Wuhan, the provincial capital. 10,000 cases right now is 17,000 growth of confirmed cases in the.
Yeah, as you can tell, not a very good connection there, but a very important story, wanting to bring you an update in terms of the coronavirus. Let's try other means and we'll reconnect with Mr. Xin-chen. For now, news abroad, the number of deaths from coronavirus epidemic in China has risen to 259. That's the latest stats we have. The announcement by China's health authority comes as the United States announced new border restrictions on foreign nationals who've been to China. Chinese health authorities have announced that 11,791 confirmed cases of coronavirus infection have now been reported. The National Health Commission said in its daily report that 1,795 patients remain in a critical condition. Close to 18,000 others are suspected of being infected with the virus. A total of 243 people have meanwhile been discharged from hospital after recovery. The government of Botswana has reported its first suspected case of coronavirus. A health ministry statement says the suspected case was registered at the Sir Siretsegama International Airport. The suspected carrier flew in from China using Ethiopian Airways and has been isolated as investigations continue. The ministry has advised travelers to practice good hygiene and avoid affected and crowded places. Travelers have also been asked to ensure that they are screened at points of entry.
This person came in yesterday afternoon by the said airline, and upon entry and following the general screening guidelines, he was noted to have some symptoms, and subsequently on travel history, he was quarantined. Currently, the patient is undergoing investigations and is quarantined until is confirmed whether or not the patient does have coronavirus.
All right. So his quarantining is based on his travel history, but he's not symptomatic.
He did have some symptoms. He had some sore throat and others. So on the basis of travel history and the symptoms, he was quarantined.
All right. So is Botswana confident that it's able to manage if the coronavirus does in fact arrive in the country?
You can never say you are confident. However, our public health response system is trying its best to combat the potential spread of coronavirus in the country. As of now, what we have done as a country, which has been an ongoing process of public health emergency preparedness, was to train rapid response teams nationwide. And so far, we have activated them. And we are doing the retrainings and hopefully in the near future simulations so that early case identification can be done. To ensure that there is no unnecessary exposure to the rest of the population.
Well, we want to get back to that story where we're trying to talk to Xin-chen from Wuhan. We didn't quite get a good connection on Skype, so we're going to try it telephonically. Mr. Xin-chen is a specialist reporter based in Wuhan. A very good morning to you once again, Mr. Chen. I'm going to ask you to just rehash what you were saying, because we lost it as you were speaking there, in terms of the latest on the ground.
Sure. So first, let's talk about some numbers and big numbers. So the latest number of confirmed cases across China right now is still almost 12,000 confirmed cases. And in addition to that, there are also another 18,000 suspected cases. And we're seeing this rapid growth in the number of confirmed cases during the past 2 weeks, and some experts believe that that is due to that because China right now, there is more effective ways to detect the virus, to find patients actually have that virus. I am right now in Wuhan, the capital city of Hubei province in central China. It is still the worst hit city by the virus. But we're also seeing a good trend, a better trend, is that we are seeing an increased number of patients who cleared from the virus. And yesterday's number, there were another 72 patients cleared from the virus, while that number was a single digit about 2 or 3 weeks ago.
We've seen news stories now saying masks are not enough to protect one from contracting the virus. What is being said where you are?
I think surgical masks are, in fact, still the best way for protection, according to doctors that I've been speaking with. And right now, I'm speaking with a mask on my face and speaking to you on the phone, because doctors still suggest, as a reporter, because I'm going to communicate with others, I'm going to see a lot of people, I'm going to walk on the street, I should not take my mask off. But indoors, if I'm staying inside with a good, sanitary environment, I can take my mask off, in fact. But there is definitely a shortage of masks, especially those medical-graded N95, the top-graded masks. But meanwhile, our doctors are saying, the regular surgical masks are good enough to protect everyone from the virus, and but we need to change the mask very frequently, every 4 to 6 hours.
You're talking about the shortage of masks, but there's also been reports of shortages of food and medicines. What's the story there?
Supermarkets are still open. That I really have to point that out. Supermarkets are still open, but they open at not their normal hours. They start a little bit later than usual. They will open their doors at 12 o'clock in the morning, and then they close at 5 in the afternoon. So that is 7 hours of operation compared to their regular 12 hours of operating hours. But we're not seeing a shortage of fresh produce for now. The day before, I actually followed a full truckload of Chinese cabbage, how it entered into the city and to put on the shelves. Again, Wuhan is on lockdown, and Hubei province is pretty much the entire province is on lockdown. Transportation is limited at this moment. However, I've been speaking to supermarket management and the logistics companies, because Hubei is an agricultural province. The pressure for getting fresh produce within the province, to mobilize these fresh produce within the province to different parts of the province, to Wuhan, the capital city, the pressure is not that big. However, the products that need to come outside of the province because of the lockdown measure, there will be some more complications to that, because there will be more paperwork, and then it's hard to find a driver who is willing to drive into Hubei, to drive into Wuhan, the epicenter of the coronavirus outbreak.
That sense of fear, how pervasive is it?
I think that's a million-baht question, because right now some doctors are admitting that they don't really know how, because it's a virus. It changes a lot. It changes all the time, and it's for different patients. They're going to have different symptoms. Some doctors run into patients they don't experience any outward symptoms. But then when they have a CT scan about their lungs, there are irregularities happening inside of the lungs. But then there's no apparent symptoms, like no runny nose, no flu symptoms. So the doctors are still trying to learn more about the virus. But again, the lockdown measure is in fact very it's very effective, including the World Health Organization has admitted that in China, the stringent protection scheme has been helping to stop the virus spreading. And I'm not trying to be more technical, but then because we have different generations of the virus, even though in overseas countries, countries outside of China, there are confirmed cases, but then these cases are, for now, doctors are saying these cases won't really infect other people because they are the first generation infected patients.
We've seen footages of a hospital being built in China to, as part of this. You say the World Health Organization has praised China in terms of its response to this outbreak. How far is that hospital, and are there parts of it that have started being used?
So there are two emergency hospitals are being built here in Wuhan, and that two hospitals will provide an additional 2,000 beds for especially for patients with the coronavirus. And inside one of the hospitals will be topped up tomorrow and ready to receive patients the day after tomorrow. And but I think that's all we know at the moment. 2,000 more hospital beds, and right now we know that it's a state-of-art facility, and it not only will provide hospital beds for patients, it will also help provide a better working environment for those doctors and the nurses, because with no cases of doctors or nurses being infected by the virus, but in a specialized hospitals, the chances of doctors or other medical staff being infected will be drastically reduced.
Xin-chen Shoe is a specialist reporter from the China Global Television Network.